making the decision and making whatever cuts a priority and saying this is where we want our benefits to go, it puts the onus on the legislature, which gives them their money, and it also puts the onus on the unions when they go into collective bargaining about
who squawks the loudest
and what benefits end up being cut. And so the most recent PEB meeting, there really wasn't a decision made, and it shows a lot of reluctance on their part to cut their health benefits.
Yeah, and it's really unfortunate, I guess I would say as a public employee, that they shouldn't have to cut the benefits. My basic feeling about this whole catastrophe around healthcare is that our American health insurance industry has become so greedy that there's plenty of money. There's plenty of money in healthcare available, but it's just not available to healthcare.
Sure, but at the same time, when you say that PEB shouldn't be cutting its benefits, PEB has the most robust healthcare plan in the state. And they pay for things like wart removal, and they pay for things like, male circumcision, and there's all these little things in each of these health plans that no one has access to in their health benefits if they were, any other employee at any other business in the state. And so it's gotten to the point, I think, where it's gotten so big and so costly that it's, in the next few years, it's going to be impossible to maintain. And so PEB keeps growing and growing and growing, as do the costs. And now they're faced with this situation where they actually have to maybe curtail that. And I think that's the first time in their history that they've been faced with such a proposition.
But insurance companies aren't the only culprits in this. I think we need to look at hospitals. I know Carol may disagree with this, but hospital CEOs are increasingly making more money and socking it away and basically refurbishing. You go into a hospital these days, it's like being in a 5-star or 10-star hotel. I mean, I think hospitals are way over the board. I think we have to call them into question. They don't pay any taxes. They need to provide more community benefits. They need to, and even you can't even tell what charity care is, because what they're calling a community benefit and a charity care might be they're letting a nonprofit group use a room for free, for example. And I think that there's some hypocrisy going on here. Hospitals need to come to the table and be saying, okay, we don't need as much money. We can take some cutbacks. And I don't see them doing that. I see them constantly saying, we don't have enough, we don't want to pay higher provider tax. Now they're trying to hold the legislature hostage and saying, we don't want to pay any more provider taxes if you try to basically hold our hand in some way and say we have to provide a community benefit. So I think it's very unfortunate.
This is in reference, I think, to a number of bills that Senator Alan Bates has proposed that would, reform hospitals in some way by making them, list hospital salaries and.
They do list hospital salaries now. I think some of it deals with the community benefits. Some of it dealt with, rural hospitals that are type A and B, smaller hospitals that are getting higher reimbursement because of their locale.
You think that's wrong?
I think that at some point we need to look at what the bottom line of these hospitals are, and do all of them qualify? Should all of them qualify, or should they not? I don't think there should just be an overarching decision that all get the same higher level of money.
Well, because if a rural hospital doesn't have as much, they don't have as many people, they have.
But some of them are doing quite well. I mean, I can't recall the exact hospitals, but I think we need to look at hospital by hospital and have some kind of standard and say, if they're making more than a 5% margin, for example, then we shouldn't pay them this high reimbursement rather than a carte blanche. All of them get this.
Okay.
Because there are hospitals and there are hospitals. They're not all the same.
Okay. All right. So I can go along with a 5% margin, which goes back to the insurance companies who are making, like, I don't know, in some years they make 300% of what their previous year's surplus was.
Right.
And they shelter all of this profit by calling it reserves. Right. Which means that it's money that they're holding in trust somewhere so that they don't have to use it for actually paying for health care. And I just think that that's a big scam.
I think they keep raising their rates. That's for sure.
And then the only thing the insurance
else raises that fast, like your retirement funds don't
not
get
15, 20, 30%.
There are a few bills working its way through the legislature and the Senate right now that would create more transparency around rate reviews. Senator Chip Shields has 3 bills that would give the director of the Department of Consumer Business Services a say in the rate review process by making the meetings public and by publishing the proposed rate review and bringing in that director and the insurers and small businesses to the table and talking about these rate reviews. And his intention with those bills is to make those meetings more public and to give small businesses a seat at the table, because he says, they're being squeezed by these rate reviews. And so one of them passed out of the Senate today, I believe, and the other two are scheduled to be on the Senate floor in the coming weeks, I believe.
Great.
And these rate reviews, the insurance division only has authority for health plans 50 employees or less and individuals. So in the large group market, we don't have any say at all. I mean, the government has no say at all, because they basically are protected because they're doing their own negotiations and whatever. And I think the concern too, with all this rate review process is, will more employers go to a self-insured model where they don't have to meet any of the regulations, provide any of the mandates? And that's a threat as well, because the legislators fear, well, that could be an offset. And if they go to self-insurance, then they don't have to meet any kind of regulation whatsoever. They're free to do whatever they like. Employers are.
They have to. Everybody has to come to the table and put their money on the table.
Exactly.
And I think we could solve the problem.
Exactly.
Right.
But how do you get them to the table, and how do you get them to put their money on the table?
I think you expose what they're doing. Like in the Lund Report, and you show how much money they're making, you show their salaries, you show what they're doing and what their lobby is trying to do. I mean, you get the truth out there, and hopefully the truth will prevail and lead to better decisions.
If only.
That's what we believe. That's why we do what we do.
And also, people need to know what's going on.
Exactly.
Like, if just only the people in the Capitol know what's going on, that doesn't work, I don't think. I think they need to know what the constituents need to know, so that they can back this up. Because, it's the power to the people. The people united will never be defeated.
And,
so we have to all understand this.
I think so many people are afraid of this issue. They're afraid of health care. They're afraid of health reform. They're afraid of what they call Obamacare, because it's going to do something different.
They don't understand it.
They don't understand
I disagree with that. It's not fear. It's the lack of information. I mean, insurance rate reviews is incredibly complicated, as is PEB and OEB. It's very technical, wonky information that you have to spend a lot of time sifting through papers and looking at numbers and figuring out what all these different technical jargon means. And there's very few ways for that to become accessible to the public.
Well, it's
a matter of education.
It's all ways of couching greed, and that's how it's code for, we're going to couch this over here as that and this over here as that. But when you look at the bottom lines, the insurance companies are very profitable while everybody else is hurting, and they're cutting benefits and raising premiums, and a $10,000 deductible
Ridiculous.
on
It's
a
absurd.
health plan.
It's
Why
absurd.
would you call
It's
yourself
absurd.
insured then?
That's not even
It's absurd.
insurance.
No.
Yeah.
That's a money.
That's for people who don't want to be devastated by a catastrophic event, and they'll just settle for no insurance.
Well, there was a
otherwise.
single payer bill that Amanda can speak to that.
let's talk about
And there was a rally, but I don't think it's going anywhere. I know in Vermont it may have legs.
That bill has died, which in the single payer bill would have provided health care for all Oregonians, essentially. And I think it received one public hearing and there was a rally, but that was the end of that.
Would have done away with insurance companies,
Right.
basically.
Yeah, and
in
see,
Oregon.
Right.
that's tough, because insurance companies run this country. So I mean, basically, to write them out of a bill, we know isn't going to work, because they can get anything they want pretty much. So I think you're right. I think the real way to get to this is to expose it. But did that bill have support in its hearing? Or
Of course it had support from consumers and some of the liberal legislators and other groups, but the insurance companies and care providers have an extremely loud voice.
Sure.
I mean, many times when I sit in public hearings and a bill is being heard about anything, it could be about I can't think of an example right now about, the Oregon prescription drug program, for example. There would have been a bill that would have permitted all state agencies, or required all state agencies to participate in that program unless they could prove that they could find cheaper drug coverage somewhere else. At that hearing and at many other hearings, there is this refrain of, we're waiting for an amendment from Regents, like an amendment to the bill that Regents is not necessarily writing itself, but has a lot of influence over. And
Like we're waiting for the queen.
Right.
yeah, but it just leads one to question, like, who elected these elected officials? Who owns this building?
Who runs
Why?
this-
Right.
Yeah.
A lot is happening behind closed doors right now. You'll see that committees are going to start shutting down, and there are going to be fewer hearings, and things are going to shift to certain committees where the power is. And the big decisions on a lot of these issues will be behind closed doors with legislators and lobbyists. And yeah, lobbyists have tremendous power in the Capitol. Tremendous power.
And given that Oregon has a $3.5 billion shortfall, like, every legislator is looking around for whatever red cent they can find to help fund the programs that they care about. And if they come forward saying this bill is going to cost $20 million to implement, or this budget is $40 million, that is like very unpopular right now to be asking for any type of money.
Right.
And so, like, anything that is going to cost like any money in this session is definitely going to be, as Diane said, discussed behind closed doors.
So the important thing is to, for people who are watching this and hearing this, is to read the Lund Report. I know we've mentioned that before, but we are covering all the basics, all the bases. We're there at the Capitol. Amanda's there every day, and sign up so you can receive our email alerts.
And then contact your legislator maybe.
Exactly,
And say that
definitely.
you've read this and that
Definitely.
you're interested in it going this way.
Definitely.
And I think most importantly, don't be afraid.
Right, don't be
Beca-
afraid.
Even though this issue, even though healthcare and all these other issues seem formidable, and you could never possibly really understand them, which is probably true, but you can understand at a basic level
right.
when greed is running an entire industry.
Greed and power.
And it does healthcare in this country and in this state. We need to make some basics. We need to make healthcare a basic right. We need to make sure everybody has it. If you don't think everybody should have healthcare, then I ask you, who should? Who should have healthcare?
Right.
Who shouldn't? Should I have it, not you, or should she have it, not? I mean, it's
And
really
it needs to be
stupid.
affordable.
Right. Everybody has to be able to have it. It has to actually be something
Sure.
That we could
instead of
have.
nothing.
Right. And high quality.
Yeah,
And
$10,000 deductible.
And we need access. We need access to health care as well, which is really, really paramount.
You mean like having enough providers?
Right, having enough providers and paying them sufficiently so that basically people are willing to see even, the poor, the Oregon Health Plan, the seniors because of Medicare reimbursement. And those are huge issues that need to be addressed.
So I guess, we just have a few minutes left, but is there anything happening in the legislature in these next couple of weeks that people should be particularly watching?
I don't necessarily want to talk about what's happening in the next couple weeks necessarily. I mean, the House in particular has been voting on bills related to health care every single day this week, and I only expect that to continue. But I want to talk about something that happened last Wednesday that was fairly significant politically. The House Health Care Committee killed 7 health care bills last week, and that was shocking. And it was a result of the Republican caucus wanting a bill to pass out of that committee that would have allowed school districts to opt out of the Oregon Educators Benefits Board. Democrats disagreed, and what ended up happening is that the Republicans refused to vote in favor of any of the other health care bills the committee was hearing the day before bills died. So they voted in lockstep and killed 7 healthcare bills, one of which would have created permanent funding for gambling addiction services. Another one would have made it easier for physicians to volunteer to charitable organizations without medical liability. And that bill came directly out of an organization in Central Oregon that helped homeless veterans. Another bill would have, prohibited. Another bill would have prohibited insurance companies from charging people for what are called never events, when a doctor amputates the wrong arm. And all of these bills were expected to pass easily, but because of this one bill, they locked together and killed all these bills. And it was fairly
I hope none of them get reelected. That's terrible.
it was fairly unprecedented in the legislature, but it also shows how partisan things can become in the future with the House as evenly split as it is between Democrats and Republicans. And I wouldn't be surprised at all if that were to continue.
And was that made public in the Statesman Journal? Or?
No,
It's made public in the Lund Report.
We
We
broke
were the
the
one that
news.
broke that story.
Yeah, we broke the news on that.
And the Oregonian followed, but we were first.
Wow.
Cool.
Well, you
And
guys
so that was
really
something-
are setting the pace.
Yeah.
That was
in this
something
industry.
fairly
the high bar.
significant that happened.
Yeah.
We thank you so much
Thank
for
you
doing
for the
work you
opportunity.
do.
Thank you
for
for
the
having us.
opportunity. It was wonderful being here.
All right, thank you for
Thanks.
watching The Valley View. We'll see you next time.